6 types of depressive disorders. Depression is often misunderstood. People think that depression is being sad all the time and hating the world, but that's not what depression is. Depression is a combination of subdisorders, and each of these disorders has their own causes, symptoms, and intensities. Let's take a look at the different types of depression. Disruptive mood dysregulation disorder. When you have random mood outbursts, such as being aggressive, getting physical, or if you're verbally abusive at least 3 to 5 times a week, it could be a result of disruptive mood dysregulation disorder. In addition to the above, you could also be feeling sad or angry at any given time. Studies have proven that this disorder would be diagnosed if you have been living with these moods for at least 1 year or if they have started before the age of 10 years old. Major depressive disorder. This is also regarded as clinical depression. Many people with major depressive disorders may experience an extended episode, for example, 4 years, while others may experience it for a short period, for example, 1 year. Most people with MDD will experience their episodes every single day for at least 2 consecutive weeks. Some of the symptoms include the lack of motivation for the things that they usually enjoy doing, forgetfulness, fatigue, feelings of sadness and numbness, not being able to concentrate, suicidal thoughts, or harming themselves. MDD can also result in people feeling anxious and having psychotic features. Persistent depressive disorder, also known as dysthymia, which is an ongoing depressive disorder. While the symptoms aren't as clear as MDD, they do usually last for at least 2 years in adults and 1 year for kids. Some of the symptoms include a change in sleep cycle, feeling hopeless, poor concentration levels, loss of motivation, low energy, and poor self-esteem. Dysthymia can be mixed with other disorders and can be ranged in terms of severity. Premenstrual dysphoric disorder. This disorder is disabling at least 3 to 8% of women with no real explanation. At least 5 of the following symptoms will need to be present during a menstrual cycle in order for a woman to be diagnosed with premenstrual dysphoric disorder: increased mood swings, loss of motivation, anxiety, hopelessness, feeling overwhelmed or tired and sluggish. Some of the physical symptoms include tender breasts, gaining weight, bloating, and joint pain. Despite having this disorder only during a menstrual cycle, these symptoms can hinder relationships and affect a woman's attendance at work or school. Substance medication-induced depressive disorder. This disorder is present during the use of medication or substance abuse. Some of the symptoms include hopelessness, bad tempers, irritability, depressive episodes, and no interest or pleasure in anything. In most cases, people will use medication or substances to feel better or escape their reality, seldom realize that they're displaying the mentioned signs. Depressive disorder due to other medical conditions. Other medical conditions such as HIV, strokes, viral infections, arthritis, and many more can cause people to have depression. Some of the symptoms include a lack of interest, irritability, elevated or expansive moods. Do you know anyone who has been diagnosed with depression? What subcategory do they fall into? Or have you been diagnosed with depression and would like to share your story with us? We would love to hear from you in the comments section. As always, thanks for watching. And remember, if you like this video, then be sure to check these as well and subscribe for more.